approached us at Brig Consultancy back in 2019 to help them analyze and improve their cybersecurity. We were very excited by this opportunity. Having previously implemented customized security frameworks for clients, we knew we could really help MHS be a pioneer in cybersecurity and healthcare, especially as they had already begun this journey. Having analyzed their situation, we found the core problems that they needed to address were threefold: island hopping, insider threat, and grey market and counterfeits. Having weighed the pros and cons of various market solutions, our proposal to them embedded the CIA triad of cybersecurity, which is confidentiality, integrity, and availability. So our proposal was to first implement multi-factor authentication, MFA, and just-in-time privileged access management, JIT-PAM. These two together would help combat the insider threat and island hopping issues respectively. With MFA, you're adding additional channels for identification and authorization, and with JIT-PAM, you're ensuring not only the right user is able to log in, but also they have the correct access and for a specific amount of time so as to complete their tasks. Next, to combat the issue of grey market and counterfeits, we proposed a blockchain solution to gain transparency and reliability. When they implement these solutions, they will start seeing immediate benefits. Data breaches are expected to reduce by just under 85%, and grey and counterfeit goods will be reduced by 30% in year 1 and as much as 70% from year 3 onwards. In terms of cost savings, MFA and JIT-PAM together will save $6.3 million, with the 5-year total cost of ownership being $4.5 million. This gives an ROI of 39%. And apart from the monetary gain, they also will be able to safeguard their data better.
What is the biggest challenge the world is facing right now in the term of health industry? Is counterfeit drugs, is related with the counterfeit goods. Do you know the US market loses $21 billion and the worldwide loss is $200 billion in terms of counterfeit drugs? This is not economical problem. It is also related with the health risk of children, patients, and many others which we do care. Every year 500 children die because of these counterfeit goods, counterfeit drugs. Our solution is to provide you a blockchain, a private blockchain which is based on hyperfabric parameter. By doing this, you can control your supply chain, you can provide robustness, your data will be only visible to you and to your vendors. So you will be having control, you will be having transparency in your blockchain. This will reduce the price of the goods, and it will also help you to figure out like from where the intricacies of those medicines are coming in your blockchain. We are not building up this from ourselves. We got insights from most of the leaders in the US companies such as JP Morgan, SAP, Walmart, Marks and Spencer's. They use private blockchain. They have applied this technology and they have provided a good result in the terms of economics.
As a project manager, I'm excited to work on such project because it's not like technical innovation, but we are planning to use innovation approach in the project management methodologies. Because we want to use classic waterfall for schedule the whole project, and we will use agile methodology, Scrum, during our software development phases. And we expect that we can finish the whole pilot project just in 2 years. And we understand that we should spend some time to choose right partner, manufacturer, GPO, to work in this project, and we should find the right contractor. Also, we understand that it takes time to write appropriate technical tasks because it's really important when we create a new software. But this project is not only about technologies. We are working with people and a lot of different stakeholders, such as our vendors, our partners, patients, community, government, doctors in a hospital. So we want to create a special environment for each of the stakeholders. We are planning to create a web page in social media. We want to use modern software such as Slack, Trello, so each of our stakeholders can find information that they need just in a second, and they can be really involved in our project.
So for this project in 2021, we will do a pilot project. Starting from 2022 to 3, we'll do a serial implementation through our suppliers. And starting from 2022, we'll start the sales to hospitals in the US and go to the global market in 24. So how much investment cost we need for this project? We need around 975K initial investment in the year of 2021, including platform building, which is a one-time cost, and other ongoing costs such as onboard deployment, cloud cost, and maintenance. Our initial fund will be composed of two parts, 400K from private funding and 900K from bank loan, and we will be able to pay back the entire loan in the second year of business. Rest of our net income could be distributed to our stakeholders. Here is a projection of the cash flows of this project in the future. First of all, we begin with our estimation of sales. Our estimated price is 120K for each customer, and we project to have 100 customers in the first year, which is around 4 hospital networks. The assumptions of number come from the IBM 2018 income statement, which is currently a leader in the blockchain industry. We'll do the implementation in 2021, and from 2022 to 6, it will be our penetration stage, where we will have a faster growth of customer number and a higher marketing cost. As you can see, we will earn positive income in the first year, and by the end of 26, we'll have a 8.9 net margin. Start from 2026, we'll enter into the maturity stage, where the growth rate of our customer number will be relatively low, but also our lower marketing cost, and the cost of technology is getting lower each year. Here is an overview of return on investment of this project. Our net income will grow to around 48 million in the year of 2031. This will be a perfect time for us to go into the blockchain field, to take advantage of the strengths of US healthcare industry. As the systems are going to consolidation, there are a lot of government support, and many new startups are right here in the US to become the world leader. Therefore, this is not only a great investment opportunity, but also a great opportunity for us to solve the counterfeit problem and defend the patient health.
With the US healthcare industry analogous to the EU healthcare industry, we plan on entering the EU market and partnering with local vendors to gain their expertise and grow our business to $200 billion and help make the world a better place. Thank you for your attention, and we are now happy to discuss a pricing strategy for our services provided and pave the world to a better future. Goodbye.